My name is Nurse Engee. Today's topic, we're going to be talking about cataracts. Cataract is a clouding or opacification of the lenses, which leads to impaired visual acuity. As a client ages, their eyes age, and the lenses in their eyes age. The proteins and the fibers change and degenerate. This can be unilaterally or can happen in both eyes and happens as the client ages. Other risk factors that can cause a younger client to develop cataracts include trauma, smoking, and alcohol use. Diabetes mellitus, especially those with uncontrolled blood sugars. Radiation of UV light exposures like sunlight and corticosteroid uses. What are the clinical features of cataracts? How will a client with cataract present? This is a painless progressive decline in vision. The client might state that there is like looking through a window that is dirty or cloudy. The client will report difficulty driving at night and reading road signs. The client may also experience a glare or halo vision with bright light. You can see in the image that the light comes through the lens because it is cloudy. It disperses and separates that versus bringing it to a focused one point. What are the diagnoses of cataract? Diagnosis for cataract is done with an examination with ophthalmoscope and also slit lamp microscopy, where the pupil is dilated so that the examiner can see clearly and then they can determine the degree of the cataract. When assessment is done of the eye with cataracts, it often reveals reduced vision acuity, opacified or cloudy lens, and then loss of red reflex. You can see here in this image that when a light is shined on the retina, it will equally reflect red. But in the case of the bottom image, you can see that the opacified lens doesn't allow that light to get to the retina and it appears white. What are the treatments for cataract? Currently, there is no treatment for cataract except for surgical intervention. The client may be able to put off surgery by getting an updated eyewear prescription, but that will normally only help temporarily. Cataract surgery is an outpatient procedure. The client will come in and will be given eye drops that dilate the pupils. They will also be given non-steroid anti-inflammatory eye drops, which will decrease inflammation or edema. In the actual surgery, the cataract is removed and an artificial intraocular lenses is implanted. Surgery is normally performed on one eye versus doing both at the same time to prevent vision loss if complication arises. Generally, one eye will be done and then a couple months later, the other eye will be done. Surgical complications that we may need to look out for are hyphemia. This is when blood collects in the anterior chamber of the eyes. The client will feel pain, blurry vision, and be uncomfortable. Other complications include intraocular infection, retinal detachment, and lens malposition or dislocation. And this is when the lens shifts after the procedure. Postoperative teaching for cataract includes knowing when to notify the surgeon after surgery. The surgeon must be notified if visual acuity suddenly worsens. The nurse needs to explain to the client that for the first couple of hours after surgery, your vision might be blurry. But every single day after that, it should improve. The client must notify the surgeon if that improvement is not occurring or if it suddenly gets worse, because this may indicate retinal detachment, which is a medical emergency and could cause complete vision loss. The client will also be taught to elevate the head of the bed to 30 to 45 degrees to decrease intraocular pressure. The clients want to avoid all activities that increases intraocular pressure, like straining during constipation, coughing, heavy lifting, bending over, or flexion of the neck. The client will want to avoid these activities until cleared by the surgeon, because an increase in intraocular pressure may cause edema, which will cause healing and may cause hemorrhage. The client will also want to monitor for infection, looking for redness or purulent drainage. And the client might want to wear an eye patch at night. This will protect that surgical site. Also, it will protect any corneal abrasion that the client might rub their eyes or scratch their eyes, not even knowing it. The nurse will also want to observe for the clients and their ability to administer their own eye drops. Sometimes accommodation needs to be made for a client who has something like rheumatoid arthritis. The client will be prescribed antibiotic eye drops, which will prevent infection, and then they will also be given a prescription for corticosteroid or non-steroidal anti-inflammatory eye drops to decrease pain and inflammation. In our teaching, we also want to teach the client what to expect, what is normal, because we want to reassure them postoperatively. We want to let them know that they might feel like there's sand in their eyes, and that might last 6 to 8 weeks. Also, they might experience photophobia or light sensitivity. This can last months, and they might need to wear sunglasses in bright light. This ends today's topic on cataract. I hope to see you next time. Bye.